Hi guys, Dr. Brett Stompro here. How are you? We're doing a facelift today, and I wanted to go through kind of the mechanisms and kind of the nuts and bolts of how we do a facelift and how we approach it. First and foremost, facelifts have evolved over the decades. I mean, I remember when I was doing facelifts 20, 25 years ago, it was a certain way, but the facelift that I'm doing now is way different from the facelift that I was even doing 5 years ago. Just like your cell phone, there's many advances that occur with technology and just our knowledge. The aging face ages in three major domains. The first domain is that of relaxation. We lose some elastin, we lose some collagen. With gravity, things begin to sag. We treat that with facelifts, brow lifts, eye lifts. They're wonderful. But the second major domain of aging is that we lose our facial volume. As we age, we lose a little subcutaneous fat. Things become hollow. Things become drawn. So replenishing that is a remarkable advance with fat grafting or fat transfer to the face, where we harvest a little bit of your own fat, spin it down in a centrifuge, and then re-inject it in strategic locations. A lot like people get fillers to their cheeks or their lips. It's your own fat and it lasts forever. The third major domain of aging is that of the skin. Imagine parking your car outside for the entire year. Dust, leaves, droppings, everything else. It's not going to look good. But when you get that car detailed, it looks beautiful. Same thing with the skin. When you resurface the outside of the skin, it looks remarkable, it looks glowing, and we want it all to fit. So that's what I'm doing. When I'm doing a facial rejuvenation, I usually am addressing all aspects of the face, and I'm addressing all three domains of the aging face. So I'm going to be doing some lifting, I'm going to be doing some fat grafting, and I'm going to be doing some resurfacing. This lady shows, the typical type of aging. The brow has come down, there's some lines that are etched in her face. You can see that there's excess in the upper lid as well as in the lower lid area. And then her lips have, fallen a little bit, they're thinned out. And then in through the neck, we get more fullness in through the jowls, and we also get some crepiness in the neck. So how do we take care of that? Well, with a number of procedures. Here she is after her procedure, and you can see that by doing the brow lift, we're able to elevate the brow up into a nicer position, doing an endoscopic brow lift. Tiny incisions here, we go in with a scope, we elevate the brow. We also trimmed a little bit of extra skin from the upper eyelids, and we took some fat out of the lower eyelids. The other thing that we did is that we restored some fat in through these hollow areas, in through the cheeks, as well as her lips. So we did some fat grafting, and then we did a lower face and neck lift to address the jowls as well as the banding of the neck. Finally, with the last thing we did was a little bit of laser resurfacing, where we smooth the skin, remove that top layer, and allow that younger and healthier cells to come to the surface. So overall, we addressed three of the major domains of the aging face, namely with the lifting, also with the fat grafting, and also with the resurfacing. And now she looks beautiful and she looks natural. And that's the key. If you address all three domains of the aging face, now we know that everything is going to fit, everything is going to match. I think she looks great. She doesn't look overdone. Our biggest compliment is if no one knows we were ever there. So it's off to the operating room, another facelift today. Thank you so much for your trust and confidence, and we appreciate that very much.